Hey, does the word hospice scare you? I mean, the word hospice, you wouldn't say it at a birthday party, right? Because of the connotation it brings fear, worry, death. But most of the time, what we've heard over the years is that when someone has gone through hospice and they have experienced the good side of hospice, they usually say, I wish I wouldn't have waited so much longer to start hospice because I got so much support, so much help, supplies, DME, durable medical equipment, a nurse, an expert to guide me through this really tough time, this tough season. So, in this Hospice Live, we're going to walk through a story, Don, and help you understand the good side of hospice and all the benefits that are available through Medicare for you and for you and for your loved one. Let's enjoy this time. See you guys soon. All right. What's up, guys? Hope you guys are doing good. Welcome to another Hospice Live. I'm going to bring in JT, Executive Director, here as well. What's going on, JT?
What's up? Good lunch, good afternoon.
Yeah, I know, right? It's already today is Tuesday. It's like we were just talking recently about how like the month of July is already here, and then the end of the year is going to be here by the time you know it. It's amazing. We just finished the World Cup recently. That was pretty fun to watch. But yeah, I think one of the things that we've been doing over the last several months this year is just walking families through the ins and outs of hospice, because the word hospice is scary. JT, we hear that all the time, how there's just so much unknown when it comes to hospice.
Yeah, we've kind of taken this year, starting in January, doing these Hospice 101 lives. So thanks for joining us if you are joining us live. Otherwise, if you're watching this back, welcome as well. But the purpose of these is, like Charles said in our introduction, you hear that word and it is intimidating and scary. And so this is a softer approach for you. It's not a phone call, it's not a meeting yet. If your family is nearing it, this is just kind of almost like a simulation of what it looks like when a hospice agency, not just us at Charlene, but when any hospice agency comes in and educates you on what it all looks like, what it all means, what that word means. So we've been doing these real stories, taking some of our patients, taking their story, of course, not taking our actual patient into these videos, but retelling their stories from the perspective of a family getting to learn about what hospice means.
Yeah, no, and you can use this if you're watching this. You can use this as almost kind of like a study guide in a way to kind of understand the ins and outs of hospice. And then when you do need it, just like JT said, if there's a hospice that's going to come and do an interview, you can at least ask some questions so that way you can pick the right one for you too. So super great. Let's dive into it. JT, let's start with the facts. And we always talk about facts. So
Yeah, of course. So the reason we talk about it is only about 50% of people ever actually use their hospice benefit. And so we know here in the city of Plano, uh, 50% of the population will be over the age of 65 by 2030. And so, uh, we're in the dog days of the summer. We're in July, and adult parents are in that sandwich generation of taking care of their aging parents and taking care of their children. And so we get several phone calls about what all is available to someone at home. And so hospice, you've maybe heard of it. You've maybe seen it in a movie or heard about an extended family member, someone that's experienced it, but it's a right and a benefit that you have under Medicare, that's designed, for 6 months or so, um, for someone to receive the care that they need to keep them safe and comfortable at home. And it looks different for everybody, as we'll kind of get into here today.
yeah. And the biggest thing is, like we kind of talk about all the time, is the benefit is there for families to utilize, and when you do utilize it, there's that extra support. And so we'll roll into a story, a real story retold today. Previous patient of ours, what we've done over the last couple months is had a patient of ours retold it, so that way you can sit and be in their shoes and understand Don's story when it comes to hospice care. And so Don, the family man, Don was a high school shop teacher, built furniture, was really good with his hands, fixed everybody's lawnmower. He was just the go-to guy, and never sat still. He married his wife of 58 years, 3 children, 6 grandkids. It's like your ultimate like dad, right? An ultimate grandpa. There is this like TikTok. I don't know if you ever saw it, JT, on TikTok. There's this guy who goes in and talks about like recommendations on like if you're a dad, this is what you need, how to tie a tie. I feel like that was Don, you know.
Yeah. No, that's good. That's right.
Yeah, and so Don was the guy, right? And so, he's the pillar of the family. Over the several months, uh, Carol noticed some changes. He got tired a little bit easier, which was kind of unlike him. Stopped working in the garage, which was he was always in the garage. Forgot some of his appointments. Started losing weight. He wasn't on like a diet or anything. Like he just started losing weight, walking slower, used furniture. There's this phrase that you guys may have heard. It's called furniture walking. So like when you're getting up and when you walk and you start moving, you're trying to hold it on to the stair rails. You're holding on to that. He started doing that, and everyone was saying, "Oh, he's just getting older," And so at that time, JT, I think home health was initiated, and that's why we got to know him.
Yeah, yeah, and so home health is not exactly what we're talking about today, but we see oftentimes a progression of the levels of care that are at home, and so home health is usually covered either by Medicare or a commercial insurance plan, and it provides that extra support at home that is more than just doctor's visits.
Mm,
So it can be ordered by, primary care physician, even a cardiologist, an orthopedic surgeon if you get a joint replacement. And so that's physical therapy, occupational therapy, skilled nursing to help with, medication reminders and things like that. And so the focus for Don with his home health care was on that mobility, strength, the OT is there to help him with his activities of daily living around the home. The physical therapy is there to help him, you know, ambulate around his house well. And so sometimes home health is just there for a short term and then you graduate essentially. But sometimes if a decline continues, then, that's where maybe hospice care is introduced to a family.
mm, yeah, yeah. And then
Yeah.
changes began to happen too, right?
Yeah, and so this we see this, happen to some of our home health patients where even though we're there, 2 times a week for physical therapy or something like that, there's a fall, UTI, and they're just not getting to that baseline or improving like the doctor had hoped under home health. And so we see some of the telltale signs of maybe needing to talk about hospice is when they're incontinent or can't dress themselves anymore. They're not eating as much. There's weight loss, more sleeping, some of the things that you see here. And so whether it's the family that initiates the conversation or a good home health team that sees some of these things, that's where this scary word hospice can come in.
Yeah, yeah. And I think that's kind of like the hardest part for families is like, okay, we've tried everything, we've done everything, and then, Carol goes to see with Don, his physician, because they went to the hospital recently, and he's like, we've treated infection, we've completed therapy, we've addressed nutrition. Unfortunately, he continues to decline, and so now there's a change and a shift from treatment and moving forward aggressively and now quality of life. And that's usually when some of the best doctors that we've seen over the years is that they introduce the word hospice in a way that's now tied towards the family's goals, right? On what are your goals now for just quality of life? Do you want to keep going back and forth to the hospital because he gets tired, he gets wiped, he may have an infection at the hospital. So now it's quality of life. And a lot of times that's where we see families say, okay, whoa, all right, I've never thought about hospice, or I've heard hospice. And when I hear the word hospice, it's at the last minute or the last second. Or not only that, it's, I've heard bad things, or I've heard some bad scenarios or situations from a friend of mine who their mom was on hospice and they were just pushing medications and nobody was there to help support them. And so there's just like so many horror stories too. And I think that's where we wanted to do this. And so if you're watching this for the first time and you're hopping on, whether this live or a recorded video from a while ago, the goal of these is to educate on what is hospice and to help you understand at least the basics of hospice so that you're informed. And then if your loved one, or someone, a friend, or someone needs hospice, you can at least know what it entails and how it is there to help support you and your family or your loved one. And so, JT, let's walk them through like the three things that we always talk about when it comes to hospice and what it is.
Yeah, yeah, like we said earlier, it's a benefit or a program that you've paid into your whole life, and that not everyone will use or need. But for those that do, we come in to focus on those pain and symptoms we talked about with Don, but also in this season of life, the emotional and spiritual support that's needed. And we'll talk about who exactly does that, and then honoring the patient's wishes as a big one. It's always good to have that conversation with parents early on about what their wishes are. But that's what the whole team can come in and make sure that we're respecting those as well. Where it happens, wherever you call home, we like to say.
Mhm.
So if it's a group home or an assisted living, or if it's your home, an apartment, a house, there is what's called inpatient hospice,
Mhm.
but that's something else that we can get into later as well. And then when it's appropriate, of course, it has to be ordered by a doctor, and so usually it's a doctor that either has known your loved one for a long time, or if they're in the hospital, the rounding doctor through the hospital may assess your loved one and think that it's time for it. And so those are kind of the first steps of what it looks like.
Yeah. And as we were guiding families through, I think the things that we always talk about is like the three parts, or the three there's so many parts when it comes to hospice, right? But like, I think just to kind of take it a bite size at a time, there are three areas that you can kind of wrap your mind around to understand hospice. And that's the care team, which is like the nurses, the chaplains, the aides, right? The hands-on people that are there to care for your loved one and support you through this terminal diagnosis. Then you have supplies, and DME, which is durable medical equipment, and then you have medications. So let's walk you guys through these three areas so that you have a good understanding. I'll break down care team. JT, you'll break down supplies and durable medical equipment, and then we'll come back to medications. So the care team, right? These are the people that are there to support you and your loved one through this time, right? So your first person, that's the main person, is the quarterback, is the main nurse, that's the RN. So whenever hospice starts, the RN goes out and does a full head to toe assessment of your loved one. They'll get to know you, they'll get to know your loved one, what they like, what they don't like, nickname, Donald. Okay, does he like to go by Don? Okay, great. That's good. Let me let our care team know. This is what the best hospices do, is they really kind of tailor everything that's going on, because we're guests in the home and they need to have a good picture of what's going on with Don. So the nurse will go out, review all current medications that has been added from maybe the PCP or other doctors, develop a care team, and address the needs of Don. Right now, Don's like, I don't want someone to come in here and shower me. I'm like, I'm good. Like, I like my privacy. He may be that type of person. So he may not need an aide, right? Or they may say, maybe I just need an aide to come out once a week, right? So the goal of this nurse is to kind of tailor the needs. They have a great connection with their church. And so they really don't want a chaplain to come in because they have a pastor friend that's down the street, right? But there's some families who don't have that, or maybe they don't want to do any type of chaplain services because they think that it's about religion. And a lot of times we tell families is the services are there to really help support families through grief. Because the thing that Don used to do, which is he used to be in the shop all the time and make furniture, he can't do anymore. So that right there is grief. And how does he process that? How's Carol process that? So a lot of time this team is here to help from an emotional standpoint, from a clinical standpoint, from a social worker standpoint, really to help make sure that wills in place, funeral arrangements are in place, so that way you're not having to do all that by yourself. Medicare made all these things to help support families. And then you have your hospice doctor. So, you still have your PCP who Don knows for years. But what happens is the reason why hospice has a hospice medical director, because they're specialized in terminal illness and they're specialized in this area of healthcare. Their job is to be very quick and available for the nurse and the team to coordinate. So let's say something's happening to Don in the middle of the night. You know that if you call your PCP in the middle of the night, they're not going to answer. Or if you call them, they're not going to get to CVS and get those medications that are needed. Hospice is that kind of hospital at home to help to make sure things are quicker. There's a doctor who coordinates with the hospice to get those medications quicker. And so a lot of times you'll see doctors say, hey, you're on hospice. I'm going to go ahead and defer to the hospice team because they're experts and they're there to help guide you through it. But they can give me updates every so often, so that way I'm in the loop. And we see that a lot with families as well, is that that coordination of care when it comes to the hospice care team. So this is a small piece just so you have an understanding of what the hospice care team does, and we'll go over now to supplies, actually. So DME, durable medical equipment and supplies.
Yeah, yeah. A lot of times, when Charles or I or someone on our team will meet with a family and talk about these three things after we talk about the care team, then we'll shift the focus to some of the things on the screen here: wipes, gloves, depends, incontinence supply, bed pads. They're like, oh man, I'm buying those from Walmart every week. I'm shipping them from Amazon. And so a benefit under hospice and what's covered underneath the Medicare benefit is all of these supplies. And so, they'll either get drop shipped to your house or brought out by your nurse or by your aide. So that's the supply side. And then the medical equipment, that's a wheelchair, a walker, a hospital bed, oxygen, which is also comes with 24/7 troubleshooting. And so, the oxygen starts beeping in the middle of the night and you don't remember what they said when that happens. You call your hospice company and they walk you through it. And so sometimes, the patient might be a part of this hospice 101 meeting and they don't need any of these things. But we always, tell our families that everyone's journey through hospice looks different. And if we're in place at the time the doctor maybe recommends it or the family is ready for it, it allows for when things do decline or when they do need a hospital bed or a wheelchair, we're already there and can quickly support them that way.
Yeah, yeah. There's so many times, JT, we've had families where we tell them that the Medicare, this is part of a benefit that you can get depends, right? Just the simple thing of depends. And they'll be like, oh my gosh, I've been spending per pack. It's my husband's going through now 3 packs a week, and that's 20 of them. So that's 20 times 30. They're doing their calculations and they're like, oh my gosh, thank you so much. And it is a benefit. Like you said, JT, they're paying into this their whole life. Now, if you want to get the really, really nice stuff, like the high end stuff, this is Medicare, right? So this is what Medicare will offer. But the high end stuff, usually families can purchase that on their own. So, but that's great. Medications. So when it comes to medications, I think one of the biggest things is that we talked about the RN going out, doing that assessment, reconciling medications. So when it comes to hospice, hospice will cover certain meds and then not cover certain meds. So the hospice medications will be covered based on the diagnosis that's admitted to hospice care. But the best hospice is what they do is they walk the families through to help them understand, okay, hospice is going to cover these certain meds and not cover these certain meds and why, right? And walk you through, okay, why it's not covered. And then your insurance will still continue to pick up and refill those other meds. But a lot of hospices, what they'll do is they'll say, okay, great, let's go ahead and take this burden off of you. We'll go ahead and order everything and drop ship them to the house so you don't have to go back and forth to CVS or Walmart anymore. And so it just depends on the hospice. Some of them will do that, or some families are like, no, actually, I don't mind going to the CVS and picking up his certain meds. If you don't mind, I'd love to do that. So it's just about that RN quarterback tailoring the needs, because not every family is the same. Some families are different. Some families want to be more involved. Some families are like, I'm stressed. Please take everything, figure out everything for me. And so the best hospices, what they'll do is they'll tailor, right? And then and kind of guide the family through those things. And so now, JT, where do we start? Like, you have an understanding of these three areas, and now Don is like, okay, family's like, all right, I think we're ready for hospice. What are the steps? What are the four steps that families need to know about when it comes to starting hospice?
Yeah, yeah, we talked earlier about that recognition of when it might be time, and that comes a lot of different ways. It can be a very quick hospitalization. It can be like Don, a slow decline over time. It can be an oncologist, telling the family, and it may catch you off guard. So there's a lot of times that step one kind of comes in, but that's where we're asking, do we want to focus on keeping them comfortable and safe at home? And so then step two, like we said earlier as well, getting that doctor's order. It can come from a lot of different doctors, but hospices can't just go out and start anybody. It has to be someone that a doctor has deemed eligible for it. And then step three, this is a big one. This is patient choice, and so we'll go out and meet a family, and before they commit or sign up to anything, they'll say, "Well, I'm going to meet with another hospice," and we always encourage that. You know, Same way that you would pick a restaurant on a given night,
Hmm.
or pick anything, shopping. You want to make sure that you're reading reviews, you're looking into who owns the company, you're looking into what their mission is. These are all very important things that affect how the team takes care of your loved one as well. So the step three, we call it patient choice. And then step four is when you've decided your provider, you've got the order, and the family feels ready for it, the admission. And so admission is a big word because it feels like they're going somewhere. But really, the admission is the nurse coming out, doing a full head to toe assessment, ordering the supplies, ordering the medical equipment, ordering the rest of the team to come in there, the aide, the chaplain, the social worker. And from there, the team takes care of them as long as they're with us.
Yeah, yeah, that's awesome. So, JT, who pays for all this stuff? We always talk about, like, like, who pays for everything.
Right. Yeah, and we like to kind of think of Medicare as a pyramid, and at the tip of that pyramid is Medicare Part A. So that's what's covering hospitalizations, rehab stays, and then hospice care. And so the reason we relate it to those other things is because the amount of things that come with it, all the supplies and the DME. Charles said earlier, it's a hospital at home, and that's the level of care that Medicare is given it. Anything covered by Part B, like physical therapy or doctor's visits, there's gaps in communication, weekends, after hours, but anything under that Part A is 24/7. And so it's covered by Medicare Part A. And if you don't have Medicare, you're under the age of 65. There are some insurance providers, commercial plans that have a hospice benefit. So just reach out, directly to your rep or whoever it might be, and you can ask that as well.
Yeah, that's awesome. And then another thing that we kind of talked about is the different qualifications, right? So in Don's case, there is a term that I think a lot of people have heard over the years called, like, failure to thrive. And so, like, Medicare doesn't really, there's not like a diagnosis like that, right, for failure to thrive, but it is a combination of several different things that paint the picture. And if we go back to Don's slide that we were kind of talking about before, you can kind of see in this situation, he had several things. He was going through a UTI, right? Hospital, weakness. He needed help assistance with dressing, transferring, appetite. He lost 15 pounds. He's sleeping more than 16 hours a day. All these things are painting the picture of his need for extra care. And so a lot of times in this situation, there's not a direct diagnosis like cancer, where he's got, literally, he's not stopped doing chemo and he's not doing those infusions anymore, and right. And so that's really definite. So what happens is that the hospice has to paint the picture of the need for hospice, and in this situation, he would qualify, right? And so there's several different things that, whether it's diagnosis based, that paint the picture for the need for hospice care. And that's what the hospices do. They coordinate with the PCP and the referring doctor to say, okay, let's get as much information that we have to see if, Don qualifies, right? And then on the flip side, we have patients where they're on hospice and they bounce back for some, like something, only the Lord knows like when someone will pass, right? And so they'll graduate off of hospice, and so they don't qualify anymore, which is a very hard part. I think it's hard for families because like you're like, okay, grandpa's gonna pass away. They're on hospice, right? They just got on hospice today, and then like a year later, they're still on hospice, and so like there's this weird emotional fatigue of like, whoa, like grandpa's still around. Like I thought grandpa wouldn't be here in the next week or two, right? And JT, we see that a lot too as well.
Yeah, yeah. There's like we don't know, our nurses don't know. A lot of them are asked, by family members or even by patients, how long is this going to last? And none of them, give a prognosis because that's not their call to make. There are sometimes some signs right at the end
Hmm.
of life where they can maybe say within a day or two,
Yeah,
but for month long or week long prognoses, that's not what they're there for. They're there to just focus on the patient today,
yeah,
and focused on your loved one today. So,
yeah, yeah. No, that's great. That's great. And so now, we've gone through this scenario of Don, and now he's on hospice, right? He's at home with his grandkids, and Don is able to be at home, not go back and forth to the hospital anymore. He's able to get the care that he needs from the nursing, from a social worker, from a chaplain. He's getting the demon. You see him in the hospital bed at home now. He's got supplies now given to him. And, hospice isn't about, at that bottom, you can say sometimes hospice isn't about giving someone more years. It's about making sure the moments that they still have are comfortable enough to share their wisdom one last time. Right. And so it's about that quality of life, it's that support. And Don's able to enjoy that in his final days. And so we kind of talked a little bit, JT, about the pyramids. You want to break this down a little bit about the different pyramids when you're talking about hospice to home health as well?
yeah, yeah, this is just like a good cheat sheet in a way for families to see, what the steps look like. So home health, we talked about nursing, therapy services, short term, we're looking for improvement, and they're always, through the patient's doctor. Personal care is that added layer of, I really want someone to be with my mom for 4 hours. She
Hmm.
needs to be reminded to take her medicine. She needs her sheets changed. She's incontinent. She might not qualify for hospice yet. And so personal care is this added layer, which can also be added onto hospice. A lot of times people hear 24/7 and think that means, at the bedside 24/7. But hospice is really there. The aide might be there for 30 minutes, 5 times a week, maybe up to an hour. And so those extended shifts, personal care can be covered by cash, veteran benefits, long term care insurance. And then palliative care, we won't go too much into it today, but often gets confused for hospice care. This is a middle ground where a patient maybe still wants to do chemotherapy, but the pain from their diagnosis is really starting to get at them, and they have so many ologists, pulmonologists, cardiologists, oncologists. They're all not talking to each other and prescribing different meds. And so a palliative care program can be just an added layer to home health to let a family, you know, get some guidance as far as what this decline looks like, what this pain looks like without kind of committing to hospice care at that time.
Hmm.
And so, like we've said before, not everyone's path is just one, two, three, four.
Yeah.
Sometimes you don't need any of the three, and then one day you need hospice. And so, this is just kind of an outline of what that pyramid looks like.
Yeah. That's awesome. That's awesome. Oh, that's great. I think, over the years, like I think it's just hard. It's difficult to about, when you don't need it. It's not even in your mind to talk about these things, right? Like if you're going golfing, like, or if you're playing soccer, like the things that we like to do, you're not going to randomly think about, oh, I need to understand hospice. I need to understand home health from my uncle. You're not, right? And so the reason why we did this and have been doing this is just education and information. So, yeah, if anyone is looking to have understanding about hospice, just reach out to us. You can our number's right here. You can call 972-778-8038. And then just reach out. We're in the Dallas-Fort Worth area, Texas. And so we're always here if you need. JT, is there anything else you think about it?
Yeah, no, thank y'all for joining us as we move into August, going back to school. We've kind of been focusing on a diagnosis or a type of patient each month, and so we're gonna kind of hone in on dementia and Alzheimer's because, especially when you're bringing kids back and forth to school and you've got aging parents and they're not safe at home maybe, but
Yeah.
they don't qualify for hospice. What can you do? What does that whole season look like? And so feel free to ask us questions either on YouTube or LinkedIn or wherever you're joining us from. And if you're ready to kind of do exactly what we just did, but more specific to your family, you can book a call with our team or just call our office anytime.
Yeah. Awesome. Awesome. Well, hey, looking forward to seeing you guys next time. God bless, and see you soon.